Lyssin. Intro from Allen's Keynotes. Introduced and proved by Herring in 1833, 50 years before the crude experiments of posture with the serum. Characteristics: the sight or sound of running water or pouring water aggravates all complaints. Lysophobia, fear of becoming mad, exceedingly apprehensive. Bluish discoloration of wounds. Complaints resulting from abnormal sexual desire. Mental emotion or mortifying news always makes him worse. Cannot bear heat of sun. Convulsions from dazzling or reflected light from water or mirror. From even thinking of fluids of any kind, from slightest touch or current of air. Headache from bites of dogs, whether rabid or not. Chronic from mental emotions or exertion. Aggravation by noise of running water or bright light. Saliva, tough, ropey, viscid, frothy in mouth and throat with constant spitting. Sore throat, constant desire to swallow, difficulty in swallowing, even spasms of esophagus from swallowing liquids, gagging when swallowing water. Constant desire to urinate on seeing running water, urine scanty, cloudy, contains sugar. Prolapsus uteri, many cases of ears standing cured. Leukorrhea profuse, running down the legs. Sensitiveness of vagina, rendering coition painful. Relations: compare belladonna, cantharis, fagus, hyoscyamus, lachesis, stramonium in hydrophobia. Antidote for overaction of potencies, cocculus, nux. Lyssin antidotes effect of bite of non-rabid animals. Aggravation: stooping, heat of sun, slight touch, draught of air or electric fan, warmth, damp air. Lyssin is an analog of many animal and nearly all the serpent poisons, especially lachesis and vipera. It follows well Argentum nitricum, Conium, Gelsemium, Hyoscyamus, Stramonium, lachesis. Is followed by Gelsemium, Natrum carb, Natrum mur and serpent poisons. Aggravation: slight sight or sound of water, bright dazzling light, carriage riding. Amelioration: bending head forward, pain in neck. Heat: hot steam or hot water, warm bathing, cold air, headache. Mind: loses consciousness for a moment, a certain confusion, unsteadiness, weakness of mind. It is very difficult for him to think, sometimes impossible. Range of ideas extremely limited. If left to himself, is occupied continuously with the same thing, bringing frequently forward same ideas within a short space of time and always in same manner. Dullness and stupidity at night, restlessness. Fancies he is being blown at by several persons, some of whom are not present. Raved about the dog that had bitten her, imagined it to be near her and fought as if to drive it away. Thinks he is a dog or a bird and runs up and down chirping and twittering until he falls down fainting. They fancy that they see objects, animals and men that are not present. Complains bitterly that a fire has been lighted and that the stove is smoking, although there is no fire. Another continually directed a window to be closed, which was not opened. Strange notions and apprehensions during pregnancy. Slight fits of delirium occur. Patients frequently forget their friends and relatives. Delirium attended with constant talking. Delirium, night delirium. Insane ideas enter his head, for instance, to throw a glass of water which he is carrying in his hand into someone's face, or to stab his flesh with the knife he is holding, and the like. Mania serpentica. Stallions. Inclined to use insulting language, scold his friends, beat and abuse those near him. A kind of savageness in his temper. a strong and uncontrollable impulse to do certain acts, to spring at and bite any moving object that came within reach. Dog is continually tempted to bite her pillow at night, biting, snapping with convulsions. Does not answer. Not afraid of dogs, but dislikes to see them because their sight renews her fear. He feels as if he had heard unpleasant news or would soon hear it until 4 p.m. Felt as if she was going to get a fit at 11 a.m. Lysophobia, fear of becoming mad. Anxiety of mind, restlessness with great prostration, with pain in heart, with headache, fear of being alone. Hypersensitiveness of all the senses, restlessness driving him thither and thither, although weak enough to lie down, unusually exhausted. Head. Headache with dizziness lasting all day, in morning violent with vertigo. Over eyes in temples, very severe in afternoon, aggravation from writing, amelioration by cold air from noon until evening, from 3 to 9 p.m. Aggravation from writing, amelioration by cold air, alternating with hot flushes in face, with shooting pain in upper face toward noon, with increase of saliva and sore throat all day, aggravation on seeing water or hearing it run. Violent headache from temple to temple, frequent pressure on vertex of a cast which fitted top of head was pressing it down, pain as if head would burst, headache with nausea and sore pain in heart in afternoon, amelioration in cold air, burning aching from left side of occiput down deck, violent headache and backache. Eyes and sight. Sight of water, agitation, renews idea of pain, cause convulsions. False vision, dullness of sight, together with dilatation of pupils, sometimes actual blindness. Throbbing over right eye, inflamed, dim, watery, staring eyes with very much dilated pupils, upper lid drawn up and diminished sight, swelling of eyelids after bite of dogs in sheep. Extreme ulceration of eye, lids closed and puffed up by pus in sheep. Ears and hearing. Sudden noise causes involuntary startings. Hearing water poured out in next room makes him very irritable and nervous. During his attacks of chronic headache, which come after mental emotion or excessive mental exertion and last a day or two, he cannot bear to hear running water if hydrant is allowed to run in an adjoining room, or even if water is poured into a basin. His headache increases to an unsupportable degree. Hearing water poured out brought an convulsions. Nose and smell. Strong odors may start spasms. The greatest sensitivity to smell of tobacco, taste of snuff while wax is 1 foot distant. Frequent bleeding from nose, repeatedly some clotted blood in nose. Coryza with tickling in roof of mouth and in front of nose. Headache extends to nose. Nose itches all day. Face. Both jaws feel stiff, tingling in cheekbones, transitory drawing in left side of face from cheekbone toward nose as if in muscles in evening. Tearing in right upper jaw extending into ear, same in temple. Burning neuralgic pain down left side of face. A sensation moves about in right side of face and goes across forehead. Facial muscles become variously contorted. Continence changes its aspects frequently. Spasmodic affections take place in muscles of face, occasioning violent contortions and most horrid assemblage of features. In muscles moving lower jaw, enduring involuntary gnashing and grinding of teeth, which some have construed into a desire of biting. During convulsive attack, expression of face indicates great anxiety and alarm. Appearance peculiar, skin sallow, pale or anemic, bloated all over but no pitting. Chronic camp diarrhea. Jaws feel stiff, crawling in zygomatic arch, spasms with froth before mouth. Teeth and gums, grinding of teeth, toothache and other complaints during pregnancy with internal ebullition of blood from chest to head. Head feels as if filled with air to bursting. Aching in swollen gums on right side. Taste and tongue. Speech is labored, short and pathetic. Difficult incorrect speech. Tongue large, pale and flabby. Pricking sensation under tongue. Ranula returns periodically with dryness of mouth. Aggravation in afternoon. Soreness when chewing with hemorrhoids and constipation. Mouth. Constant sensation of intense dryness of mouth and throat. Tough, short, frothy phlegm in mouth. Saliva more plentiful but thin and of yellow color. Large quantities of tough saliva in mouth with constant spitting. Throat. Difficulty in swallowing, particularly fluids. A peculiar sense of constriction in back of throat at 3 p.m. Aggravation at 4 p.m. Could not swallow without pain. Disappeared at 6 p.m. but returned at 7 p.m. and lasted until bedtime. Constant desire to swallow, painful and ineffectual. Swallowing more difficult at 5 p.m. than in the morning. At 3 p.m. felt a strange constrictive sensation in back part of throat never experienced before. Aggravation at 4 p.m. could not swallow without great pain. Went off at 6 p.m. returned in an hour lasting until 10 p.m. When taking water into mouth, constriction was greatest. Periodical spasms of esophagus. Attempt to drink water starts convulsions, burning, stinging in throat. Appetite, thirst, desire, aversions. Voracious appetite, swallowed wheat without chewing. Want of appetite, hydrophobia of sheep. Could take no nourishment. Could not remain at table. Felt very thirsty and had no aversion to drink. On contrary, drank large quantities of water. Thirst and desire to drink, but is prevented from doing so by spasmodic constriction of throat. Attempts excite most disagreeable sensations, even spasms. No appetite except for sour things. Excessive desire for salt, abnormal cravings during pregnancy, aversion to water, imagines he cannot swallow, says he is thirsty but cannot look at water or hear it poured out. Aversion to fat food and drink, there remains a long greasy aftertaste. Aggravation after mutton. Eating and drinking. Before dinner, a very strange sensation, a strangeness of whole body, inability to take solid food, or else it is consumed with greatest difficulty. After meals, very ill disposed, every noise irritates him. If others eat apples or hawk or blow their noses, it brings him besides himself, passes away after siesta and coffee. Hiccup, belching, nausea and vomiting. Nausea with giddiness, headache and pale face. With pale face after diarrhea, food does not taste right and loss of appetite in evening at 10 to 11 p.m. Hiccuping. Continual belching of wind, convulsive eructations. Gagging when he forcibly attempts to swallow water, forces it out of his mouth. Nausea and vomiting after diarrhea. Nausea and vomiting of a foamy, mucus, dark-colored substance resembling coffee grounds. Scorbuticulum and stomach. distress in epigastrium and precordial region with dyspnea. Hypochondria. Oppressive pain in right side near last ribs with breathing in hypochondria after quick walking. Painful throbbing as if an abscess were forming in region of spleen but very deep in. Exact locality is halfway between median line and outline of left side. It lasted 8 days. With it departed remnant of a similar affection in this locality, against which 11 years of allopathic treatment had proved of no avail. Abdomen. A rending pain across abdomen from left to right in evening when in bed. General soreness in whole of lower abdomen. Stool and rectum. Tenesmus during and after stool. Dysenteric stools with tenesmus renewed as soon as he hears or sees water run. When in morning some water was poured out from pitcher into basin, pain and desire to stool returned. Dysentery. When he sees or hears running water, violent pain and tenesmus return. In a case of dysentery in summer of 6 weeks standing, in which stools were more frequent in night, consisted of bloody mucus and were followed by pains in rectum and small of back, which forced patient to walk about in spite of great weakness, could neither stand nor lie down, had drunk no water whole time, only hot tea occasionally. Stools watery and profuse with severe pains in lower bowels, frequency of stools not uniform, some days 5 or 6, others 15 or 20, usually more frequent in morning, chronic camp diarrhea. Chronic diarrhea contracted in southern camps. Stools of bloody mucus, involuntary stools, straining to evacuate, causing a violent pain in small of back and in return, afterwards compelling him to walk about, although weak. Hemorrhoidal troubles, passes blood from anus during catamenia. Urinary organs. Urine too scanty and high colored. Constant desire to urinate on seeing running water. Urinates a little at a time. Tickling, burning in urethra near orifice after urinating. Male sexual organs. Lasciviousness after eating with feeling of weakness in parts with erections in afternoon. Strong erections without sexual excitement or thoughts in evening while undressing in cold room. Increased sexual desire. Dropsy of spine with sheep. Hydrophobia of sheep. Semen is discharged too late or not at all during coition. Burning and tenesmus as if in prostatic gland and in urethra in afternoon. Painful sensation in testicles. Hydrocele. Atrophy of testicles. Testicles diminish in size, first left then right. Complaints resulting from abnormal sexual desire. Female sexual organs. Increase of uterine sensitiveness, conscious of having a womb. Swelling of womb in all its parts, extending somewhat into vagina, prolapsus. Bright redness of vaginal portion of womb. Prolapsus uteri of 7 years standing. Menstruation with hemorrhoids, pulsations in anus and weakness of back. Menses rather frequent, protracted, dark and at times fitted. During interval of menses a show that seemed quite obstinate. Anemia in conscious of disturbed sexual function. Severe leukorrhea with pains in back and lower part of bowels, sore vagina. Sensitiveness of vagina rendering coition quite painful. Menses too profuse, at times a little too frequent. Discharge of blood from rectum during menses. Weakness in back with copious catamenia. Tearing followed by pressing downward. Could not make a hard step during catamenia. Pregnancy, parturition, lactation. During pregnancy, strange notions, desires, or cravings, rush of blood from chest upward, toothache, backache, and other complaints, great sense of bearing down, intense pain from inflammation of os and cervix, great soreness in lower part of back and bowels. All changes of position that tilt or rotate to a moderate extent the os uteri cause much pain. Spasms excited whenever she attempts to drink water or if she hears it poured from one vessel into another. Sight or sound of water affects unpleasantly, even though desiring water. Since childbirth, more pain with cohesion and dislike to it. Since cessation of lochia, a severe leukorrhea, pain in back and lower part of bowels, soreness of vagina. Voice and larynx, trachea and bronchia. Voice altered in tone, tones much suppressed, hoarse, rough, harsh and weak. Shrill, inarticulate sounds. Shrill sounds of utmost despair or occasioned by violent expirations, very shrill and piercing bark, changing near its termination into a distressing, continuous howl. Pain next to larynx on right side, felt on turning neck and on pressure. Respiration. Can scarcely speak from weakness. Weakness of chest, tired from talking or reading. Sighing with pain in heart. Dyspnea with flatulency, cough and rattling in chest with sighing, groaning, respiration from cardiac pain, aggravation lying down, cough. Coughing when attempting to swallow water forcibly forces it out of mouth. Cough and gagging. Inner chest and lungs. Gangrene of lungs caused by pneumonia and sexual excitement. Satyriasis in stallion. Heart, pulse and circulation. Constant pain in lower part of heart. A very strange and unusual feeling in heart, something like bands compressing it in middle of chest and as if needles were sticking in it. A dull kind of stitching pain, very painful, alarming and disagreeable. Stitches in heart more while walking, they would kill him if they continued. Heart had for 3 months not been free from a sticking, drawing, squeezing pain, result of an attack of rheumatism and cold, together with the palpitation and difficulty of breathing. Pain in cardiac region to which he is subject is aggravation half an hour after, but much amelioration in several days. Heart palpitated violently and felt as if it was coming up into throat. Drank several mouthfuls of water which relieved. Palpitation causes anxiety. Neck and back. A stitch in nape of neck, throbbing pain extending into neck. Pain in muscles of neck and along cervical portion of spinal column. Sternocleidomastoid muscle on each side stands out like a thick cord, a look of mingled anxiety and terror on countenance. Below right shoulder blade a pressure not pressing from out inward or amelioration by bending backward. Backache and headache, pain from 4 p.m. till evening in both kidneys and across hips, severe and little burning, amelioration at 9 p.m. Great weakness in back as if it would split and fall apart. A sore lameness in back with some degree of soreness in lower abdomen. Considerable pain in lower part of back with a soreness felt through the pubic region. Pressing finger on neck increased it. Lower limbs. Pain on top of right shoulder joint. Pain in Left shoulder joint as if beaten and paralyzed, lameness in left axilla. Rheumatic pain first in right, then in left shoulder, weakness in arms, upper limbs. Oppressive pain in right hip bone goes from there to middle of sacral bone. Felt as if hip bones would slip out of their sockets. Had to rest with hands on hips to pain in thighs, particularly in anterior portion as if fatigued after going upstairs. Aggravation after sitting down. Ulcers on legs with emaciation and coldness left side, contraction of hamstrings and relaxation of ligaments of ankle joint and flexors of toes. The pain in calf came even when he was not thinking of bite at all, lately much aggravation and quite severe. Great swelling in heel of a cow from dog bite, very restless, loss of power in limbs, gait unsteady at times, some stiffness of hind legs, dog. Rest position motion. Had to rest with hands in hips, feeling as if hip bones would slip out of their sockets. Horizontal position, pain in elbows, also when allowing forearm to hang. When rising, rush of blood to head, tearing, stinging in occiput. Stooping, inclination to fall to right, aching in bones above eyes, pressing in vertex and forehead, violent headache, painful rush of blood to head, aching over eyes, dizzy on right side of head. Swallowing difficult, particularly fluids, stinging sensation, causes constriction of throat, causes terrible pain, braid causes greatest agony, stitching sensation. Nerves. He could neither lie down nor stand up for any length of time. Continual trembling sensation through whole body. The strange feeling changed during night into a trembling, and is he full of fear. Attacks returned every few minutes for 5 hours until they were arrested. Pain passing down spine to loins and hips, and from thence to knees. Convulsions daily, rolls head from side to side, winking and rolling eyes, attempts to bite others, pelvis and legs are turned to one side as far as possible. Child. At times a singular sensation, a kind of die-away feeling, quite instantaneous, cannot describe it, seems to extend through heart to back, accompanied with quivering around breast bones and pain in nerves from left side of chest to throat and left jaw, fluttering about heart. Sleep. Inclination to yawn with stiffness of lower jaw. Insomnia, sleepless in spite of narcotics. Passed most of his nights sleeplessly, walking up and down in despair. Lysophobia. Restless night with stupefaction in head. During night slept but little. Was disturbed by disagreeable, disconnected dreams, felt strangely, lysophobia. Temperature and weather. Burning sensation in beaten place, amelioration by hot steam striking against it. Cold air, headache with nausea and sore pain in heart. Attacks, periodicity. Other diseases, when poison is absorbed, have their periods. The canine poison depends on climate and constitution and different periods, from first day till 19 months. Paroxysm combined with a feeling of suffocation almost produces strangulation. Sudden convulsions of a paroxysmal character. Periodically since 2 weeks. Spasms of throat. tissues. Affects principally the nervous system. Supraorbital bones feel shattered. Aching in bones. Every bone seems bruised and sore, as if every bone had been broken or violently bitten. Never had such pains. Had to return to bed and lie there all day. All his joints cracked on least motion, and pain was quite severe till 10 p.m. Lost flesh, getting thinner all over. Touch, passive motion, injuries. He cannot bear to ride in a carriage, feels generally unwell during or after it. When water was least ruffled so as to touch a fresh surface, convulsions were excited. Peculiar sensations are frequently experienced at seat of bite or in adjacent parts, like a sensation of pricking, boring, or burning, always proceeding from wound. Complained of a pain in right arm. No inflammation or enlargement of glands of axilla could be discovered. A bite of an angry dog into right thigh had not healed. Turned into malignant ulcers surrounding bluish red edges, raised and hard, bases badly suppurating and ichorous, with redness and hardness. Scars from a bite in nose, swollen and red for 15 months. Ulcers remaining after bite of evil disposed dogs. Skin. Bluish discoloration of bitten place. Pustules on forehead, around inflamed eye, on finger. Malignant ulcers from bite of a dog. Red scar from bite of a dog. Cancerous sores. The end.